Welcome back, Dr. Kristin Lyerly, to the Devil's Advocates, wearing the Brewers colors. Go Brewers. Welcome back, Kristin.
Hey, Kristin.
That's right. Hey, guys. Thanks for having me.
Well, thanks for coming around.
What a strange circumstance that you are the recipient of a complaint. And Kristin, let's give the people a little bit of background. What is your day job? What do you do for a living, and when did that change?
My day job is I am an obstetrician-gynecologist. So I'm a doctor who takes care of women, delivers babies, does hysterectomies, preventive care, all of that regular stuff that your OBGYN doctor does. But I don't do it here in Wisconsin. I do it in Minnesota. And I have been in Minnesota since the Dobbs decision, because here in Wisconsin, we've got a law from 1849 that we don't think is enforceable, and hopefully we will have a final judgment on that soon. But it makes it really hard to provide care for women here in the state.
But Planned Parenthood has agreed to resume reproductive care and abortive care, and the anti-abortion movement, let's call them, they're looking for a target. They're looking for a complaint. They're looking for someone to be prosecuted because they want to prove the viability of whether or not this law stands up. They want to also see this. So they have filed complaints. And what are the nature of the complaints? These are not criminal complaints. They ran off to the sheriff in Dane and Milwaukee County. They ran to Milwaukee and the city of Madison. No takers. No one wants to enforce this arcane law that may or may not have any standing. But they filed complaints of what sort against you specifically, Kristin?
To be very clear, we have abortion care in 2 spots in the state. The whole rest of the state is still waiting for that declaratory judgment. So in the Planned Parenthood clinic in Milwaukee and in Madison, there is abortion care there. The complaint that was filed against me really was more of a complaint by Pro-Life Wisconsin that abortion care is being provided in the state. And the address that's listed, the 2 addresses, are the addresses of the 2 abortion clinics, the one in Madison and the one in Milwaukee, neither of which I work at because I work in Minnesota.
And Kristin, let's again reinforce the facts underlying this circumstance. You do not provide abortive care and have not provided abortive care in the state of Wisconsin since Dobbs.
No, I'm busy delivering babies out in rural Minnesota and rural Arizona, taking care of moms, taking care of babies. I don't know. They have a bee in their bonnet.
Folks, you're listening to the Devil's Advocates radio show. We got a fine guest. She is Dr. Kristin Lyerly. She's a friend of ours, a recent co-devil in Dom's absence. Kristin, appreciate you doing that. Appreciate you coming around. So what do you make of these complaints? Obviously, this complaint against you has zero merit. It's not even factually truthful, but they're really not going after you per se because you're performing abortions, but you've become a public face of this issue. Kristin, how much of this is to chill you out, if you know what I'm saying?
It's not just to chill me out. It's to chill all doctors out. You know, doctors are uncomfortable with the legal profession. Doctors are expected to be perfect because the consequences when we aren't perfect are horrible. So we do the best that we can. And when we have interactions with the legal system, it's very, very uncomfortable. And they know that. So anytime that they file a complaint or that there's any sort of a legal thing like calling the police, which happened associated with this complaint, that makes doctors feel very uncomfortable. And it makes others who see that this is happening to me say, whoa, I don't want that to happen to me too. But this is not unprecedented. We have seen this in Missouri. We've seen this in Indiana. Remember the doctor who provided an abortion for a 10-year-old girl who was raped in Ohio, and the Attorney General went after her, and the Indiana Board of Medical Practice went after her, and she ended up with a reprimand on her license and a fine, even though the medical community rallied around her, and even one of the authors of the HIPAA privacy statement rallied around her and supported her. So this is clearly political, and this is just another thing that stands between you and your ability to get your own individualized, personal, confidential healthcare.
Dr. Kristin Lyerly, the complaint is filed with what? The licensing board that license doctors in the state of Wisconsin. If something like that were to be successful, what would be the repercussions for you professionally and personally?
It really depends. I can really only hypothesize, speculate about what they would do. The next step is it goes to a screening panel and they determine whether it has legs. And hopefully, as they read through it and see what the text is, they'll understand that it's just completely without merit. But repercussions can be very frightening. Like I mentioned for that Dr. Caitlin Bernard in Indiana, she did end up with a reprimand on her Indiana medical license. And those kinds of penalties follow you throughout your career and they feel bad. Again, as doctors, we want to be as good as we can be, as perfect as we can be, because we're taking care of people. And those kinds of just unwarranted punishments are the chilling effect on physicians, on nurse practitioners, PAs, anybody who takes care of patients and patients seeking care it's so unfortunate. It's so wrong. And we've got to stand up in defense.
Oh, Kristin, I mean, this is factually incorrect. I mean, what they are saying or suggesting that you have done is not true. You haven't done these services in the state of Wisconsin. So it seems to me, number one, do you feel like this is something you should go on offense about? Because in the article we read from Jesse Point in the Milwaukee Journal Sentinel today, they also mentioned that perhaps you might be a political candidate against Gallagher here in the state of Wisconsin. It seems like they're coming after you, Kristin. What about going on offense?
Hey, I'm going to let the system work the way that it's supposed to work, and I am confident that it will. So I'm just going to brush that aside and just keep focusing on taking care of my patients, on standing up and using my voice. I'm really uniquely poised here. Most doctors can't speak out the way that I do because their employers are not comfortable with them speaking out. They are personally not comfortable speaking out. The 1 in 4 women in this country who have abortions are not comfortable speaking out because we associate so much shame and fear and all of these emotions with this very touchy subject. But I can speak out. And so it's my obligation. So I'm just going to keep focusing on taking care of my patients, on taking care of their families, on building community, not just within the healthcare system, but all those upstream things that happen as well, like public schools and making sure people can buy groceries and walk on safe streets. All of those things matter. That's it. Let's do that. Let's focus on the good stuff.
Our fine guest, Dr. Kristin Lyerly. Kristin, you have risen to a position of prominence amongst OBGYNs. You were recently recognized. I only know this because we're Facebook friends, but what is the position you were acknowledged in recently, if I may ask?
I serve a number of roles with the American College of Obstetricians and Gynecologists. So I'm on the National Government Affairs Committee. I'm on the National Political Action Committee. And I also most recently have served as the district legislative chair, as well as the chair-elect for the Upper Midwest District. So the people who I am helping so that they can continue to help their patients include people from states like Minnesota, the Dakotas, Nebraska, Iowa, Illinois, and of course, Wisconsin. And these are some of the states where women's health is most in peril.
And Kristin, I saw the quote in the paper. You mentioned the courage of your patients. Can you speak to that for a moment?
I get to sit in the exam room and hear these stories, not just in the exam room, but people will pull me aside, even at public events, and they'll tell me their abortion stories. They'll tell me their miscarriage stories and their personal stories that propel them to use their voices, to live their lives and to have these conversations, maybe not on the radio like we are right now, guys, but, with their trusted group of friends to gain a better understanding of what this actually means. Because we know that this isn't about abortion. This is all about power. And the way that we change it is through representation, through discussions, and through having these hard conversations.
And Kristin, obviously there is this false complaint that has been filed against you. Have you seen any other sort of ramification? Have you been approached negatively in the community or in public? I'm hating to will it upon you, but any other bad stuff happening?
From time to time. I mean, certainly every time I post something on Twitter, there are a lot of people who like to respond in a very negative way. But for the most part, I feel like my community embraces me. And it might be because I have a big burly police officer for a partner and he takes good care of me. But I think it's actually because people see that I am invested in this community. I spent the morning doing Frogger with the De Pere Police Department. We were making sure that our crosswalks are safe and helping to educate people who drive in some of these areas where it's kind of dangerous for pedestrians, that there are safe spaces for people to get out and be with their families. I'm out at the farmers market. I'm out at, wherever I can be to just create that sense of community, to encourage people to eat healthy foods, to support public education, all of those really necessary things that bring us together. That's where you'll find me. And it's not because I'm running for something. It's because I care.
Well, I know you do. You're such a strange and unique person in that regard. Our friend Kristin Lyerly, it is so unique to meet a person with a big heart. Kristin, though, let's talk in a practical sense. Part of why you've got this time on your hands is you can't perform your job the way you used to perform your job. You used to be, and I don't mean to put words on your resume, but if I understood correctly, you were working in a hospital group in Green Bay in the Fox Valley. And you're no longer able to do that, not successfully, not the way you would like to. So this has created time because you can't perform your job in the same way you used to. Do I have that somewhat correctly, Kristin?
Yeah. Well, when Dobbs happened, that time I had been working at Planned Parenthood in Sheboygan, and I knew that I wasn't going to be able to work in Wisconsin, even providing general OBGYN care, because what people don't really understand is that you can't just take abortion out of OBGYN care, especially in a hostile political environment like Wisconsin right now. There are aspects of abortion care in miscarriage management and in infertility treatment and helping people get pregnant. In complicated pregnancies, these heartbreaking situations where somebody's water breaks at 17 weeks, that's abortion care. So in order for my colleagues who are here holding the fort and taking care of people every day and trying to help them find answers and resources, I am using my voice, but also providing that care in a space where I feel safe.
Kristin, my understanding is there's not enough OBGYN. Setting aside abortive procedures, there's not enough doctors, especially in rural care facilities. Well, this 1849 ban that's unresolved, at least in the current sense, in Wisconsin, has made it very difficult to produce new doctors. My understanding is this is stunting the ability of the UW Medical School to turn out new doctors. Could you speak to that as well, please, Kristin?
Well, we have evidence that the doctors in training are reluctant to match into programs in states that have abortion bans like ours. And we know that there are a lot of people who want to practice here. Actually, we've got a medical school here in Green Bay that was created to solve this crisis and bring people to rural parts of the state where there has been a lack of medical providers for years. We've got solutions, but now we've created this climate where people don't feel comfortable coming back and practicing. So this is not just impacting us here and now, but this is going to impact us for years and generations in the face of what already is a profound physician shortage.
Kristin, in our last minute, when you practice at a Catholic hospital, how does that change the care you're able to provide?
To put it in one word, contraception. In a Catholic hospital, we can't provide contraception. So I could be doing a C-section and looking at somebody's fallopian tubes, and if they want sterilization, I can't take those tubes out.
Dr. Kristin Lyerly, sorry for your trouble, sister.
Listen, brother, we're all in this together.
Well, we certainly are, and you'd make a hell of a compelling candidate for something. If you ever want to consider running for something, you let us know. We give you a little bump.
All right, you'll be the first to know.
Please. Dr. Kristin Lyerly, thank you so much for coming around. We are the Devil's Advocates. We're not done yet. We'll open up the phones to you. It'd be nice if our friends, air quotes, on the right, considered facts and evidence. No one rolling out their lawsuits or their impeachments or their complaints. Come back with us. More Devil's Advocates. Phone lines open right now. Toll free for you. 844-967-2789. Thank you, Dr. Lyerly.
Thanks, Kristin.
My pleasure. Thanks, guys.